Hello, my name is Dr. Dewan S. Raja. Today I will discuss about tongue tie or ankyloglossia. The inferior surface of the tongue is connected to the floor of the mouth by the frenulum. This is the inferior surface of the tongue, and this is connected to the floor of the mouth by the frenulum. This is the floor of the mouth. This is the frenulum. Sometimes the frenulum may extend to the tip of the tongue. So it may go up tip here. Normally what happens? Extensive cellular apoptosis occur and the tongue is freed from the floor of the mouth. This happens during the intrauterine life. Apoptosis means programmed cell death. Okay, so the tip area, then a significant part of the undersurface of the tongue is free from the attachment of the frenulum. But in case of tongue tie, it does not disappear by means of apoptosis. Rather, it is present up to the tip of the tongue. Tongue tie may be associated with feeding problem, speech problem. The child cannot utter a significant number of words in certain situations. Feeding problem, especially breastfeeding, may be a problem. Not only that, also there is hygienic issue because tongue does not move. So some food material may be blocked under the tongue. Okay, so that may happen. And the movement is restricted, tongue movement is restricted. The tongue cannot be stick out like other child. So this is the tongue tie, also called ankyloglossia. Okay. The frenulum extending up to the tip of the tongue. Okay. The tongue tie occur in about 1 in 300 North American infants. Exact cause is not known. Well, we discussed that there is extensive apoptosis, so that the frenulum should not touch the tip of the tongue. In some children, that apoptosis does not happen, so frenulum is touching the tip and it is attaching the tongue to the floor of the mouth. Okay, so that the tongue cannot be moved out, cannot be stick out. So it may be genetic. It may run in the families. Male has more chance to get tongue tie than female. A short frenulum may stretch with time, but it may not stretch. It may remain like this. Okay, so need surgical correction may be necessary. In some cases, what we do, we cut this part. We have two surgical procedures. One is frenotomy. Just we clamp this part by an artery forceps or hemostat. Then we just use the scissor to cut or snip the frenulum. And the child is able to have breastfeed immediately without any problem. And bleeding is very minimum and usually no scar tissue. But if the frenulum is very thick, then we may do frenuloplasty. Then that can be done under general anesthesia. But frenotomy is outdoor procedure. It can be done even without anesthesia, with just local topical anesthesia. Okay. So in frenuloplasty, we need a few stitches to fix the cut part to hemostat the bleeding in case of frenuloplasty. But as a whole, bleeding is minimum. Pain is also minimum because this doesn't contain too much blood vessel and nerve. So that's all about the tongue tie or ankyloglossia. If you have any question, please feel free to ask me. Please share the information with your friends. Please support my channel. Please subscribe me. Have a nice, wonderful and blessed day. Bye now.